Welcome to Beyond County Lines with Daniel and Olivia. Olivia, do you want to introduce which department we're with right now?
Yes, this morning we are meeting with the Adult Detention Facility Behavioral Health staff and our therapists. So please introduce yourselves.
Hi, I'm Mark Boshelli. I'm the Behavioral Health Manager.
I'm Thea McCollum, and I'm a behavioral health therapist for the Medium Security Unit.
I'm Al Blankenship, and I am a licensed mental health counselor and an art therapist.
Well, thank you. Good morning, and thank you for being here. So tell us a little bit about the work you all do and the Matrix program.
Well, we're in the jail, so something to think about. These are our county residents that come to the jail. Over time, the county has an initiative of trying to improve substance abuse and behavioral health services for the county. So if you think about it, everybody who comes into jail is really not having a good time. This is really probably their worst day in their life to come in traumatized. So behavioral health services, we're there primarily first to make sure that they're safe. So we get a lot of people who are off their psychiatric medications. They're homeless and feeling depressed. So our first duty is to assure their safety. So we assess people for suicidal impulses. We intervene with them. We try to treat their depression. And so if they need medications, we'll help them get to our psychiatric prescriber. But from that point, we assess whether they have medical needs. We have a medical doctor who does that. Then we really start looking a little bit deeper what brings them into jail, and that's really the substance abuse issues. We have around 85% of the people coming in have a primary substance abuse disorder. 65% of those individuals have a primary co-occurring mental health disorder. So the county is trying to put together this initiative of treating these individuals. So after they're stabilized psychiatrically, it really starts to uncover their substance abuse disorders. And that's where our program, we go to the next step, and that's called the Matrix program. This program is a 30-day voluntary program. Our inmates, they petition to get into this program. Usually we do this on a semester basis, 4 to 5 times a year. We usually get around 65 applicants. So they start right out saying, we want treatment. Mm-hmm. So we don't force that.
Is there a limit to the amount of people that register for that?
Yeah, well, not to register, that we accept in. Okay. So it's a process, and it's a culling process. Of these 65 individuals, we want to make sure that they can get along with each other. And it's a vibrant meeting where we're trying to discuss with administration, with security, as well as with the behavioral health team. We usually cull it down to around 15 individuals that can participate in this 30-day program. So it's completely voluntary. We don't force anybody in there. A judge can't force somebody in there. In fact, we will ignore a judge's order because we want to really explore and celebrate that idea of moving towards not using substances. So it's a program that is 30 days, two sessions a day. So 1.5-hour sessions in the morning, 1.5-hour sessions in the evening. It's in a separate pod, so we isolate them from other individuals in the jail. So they start focusing on basically getting sober. This is a hard process. This is not easy for them. Most of them have primarily really massive substance abuse disorders. So during this 30-day program, these are the therapists, my colleagues here. They carry the weight. Every day they're going in and having these sessions with them. So these sessions can participate. They have to basically start being sober. So it's a process. So they have to have urine analysis 3 times during this process. The groups are about criminal activity that led up to them coming in, their substance abuse disorder. How did that contribute to that? We start asking them, what about your families? You're isolated from your families. How do we get you back to your families? What brought you in here? Homelessness? Oh my gosh. The untreated psychiatric illnesses. We start revealing all this with them. As they sober up, they start thinking. So that's why sobriety is probably the hallmark of this program. So during this process, they always tell us halfway through going, this is not what we thought this was. This is hard work.
What does a session look like?
Well, it usually starts out with practicing a new skill and literally practicing. I mean, whether it's a mindfulness skill and a breathing exercise, everyone breathing together for 5 minutes, or we also go into yoga practices. The reason for these yoga practices is because when someone starts sobering up, they start feeling their body, they start feeling their muscles, why they were taking all these substances as well as their long-term trauma. And we start saying, well, here's something that helps you actually stretch out those muscles. So when we introduce them to more of a mainstream idea of treatment. So at first, they don't know how to do yoga, but by the end of this program, they're rolling up their yoga mats. They're doing it before we even show up. So it's kind of fascinating to watch.
A very holistic approach. And I could imagine, for people, entering the facility that you're absolutely right. This is a very scary time in their lives. And for many people, I mean, they're also detoxing. So they're in a very high, vulnerable state within their health. Can you talk about a little bit about, how our staff supports them and making sure that they're okay and they're getting the support they need while they're sobering up in our facilities?
I think what's a primary thing is having us be consistent with showing up. We're going to see the behaviors. We're going to see the lash outs. We're going to see the uncomfortability, the anxiety, the stress,
Absolutely.
all of it. And it usually is at us or other people in the pod. Yeah. So it doesn't necessarily have to be towards anything direct, but it's helping control that. It's helping hold that and know that we're going to show up the next day and it's going to be okay. That this isn't, this is a bad moment. You're not a bad person for having these thoughts. So I think maybe that's one way that we can help them is just continue to support them because some people, they don't even know what they're going through right now. They don't have the vocabulary to explain, I've been filling these holes for so long with substances. Now they have all these feelings and they don't know what to do with them. Yeah. They don't know how to describe them. So us just being there and letting them express whatever they need to, and then helping contain that and control that and put words to it. I think that's a big thing.
That's really powerful.
Absolutely. And we have a new person at the table. Sorry, I almost swung the mic and hit everybody. Would you mind introducing yourself?
Yeah, my name is Alyssa. I'm a licensed mental health therapist as well, and I work in the minimum security unit.
So do you have any specific stories of a specific maybe inmate that really touched you, or it was really, any of you could answer this, their story, could you share anybody, or I know we didn't ask this ahead of time, but I think sharing this really touches the people that are listening and it can make a big impact on anybody. So does anybody have any stories that they can share on an inmate that they interacted with that started off maybe extremely rough and then came out like a shining star, or anything similar to that?
Also, highlighting graduates from the Matrix program. What are some success stories that you all see? Or as healthcare providers, I think, this is definitely hard work. So I would also be interested in learning, like, what motivates you to do this work? What brings you to support these individuals? And this is, I think, in the behavioral health world, there's a breadth of service, right, with adolescents and different types of work you all could do. So I would also be interested in asking, like, what inspires you to, work with our most vulnerable population in Santa Fe County?
Yeah, that's a lot of questions.
Yeah.
And we definitely want to dive into all of that, but for myself, I love that we get to serve the population that needs it the most. Like, we have, the richest people, the poorest people, and everybody in between that comes to our facility, and the people, like Mark said, having the worst day of their lives. And to be able to serve that population is so rewarding, and there's so much gratitude that they have for us being there. There's not a lot of jails that have therapists, let alone, we have 5 of us able to support this community, and not a lot of facilities even have that at all. And we get to be the good guys in there to support them and hear them. And a lot of times people come in and they've never been truly heard or felt in their lives, and so to be able to provide that to them, to really just have a human experience with somebody else, they appreciate that so much.
And as far as like success stories, we definitely, we are really proud of our graduates, just getting through the 30 days. And then many of them continue to the re-entry program after that. And that prepares them for as long as they remain at the jail facility to go back into the community. And there's different paths. Some of them go to the Rise House, which is through LifeLink. And so, there's been several of those that we see them completing reentry, going out into that program, and that's really positive. And we've been really proud to see that and see their motivation. Like, I think their motivation motivates us because you see, like, when they began doing Matrix, they're like questioning, do they want to be there? And then as they move through these programs, they really start to like believe in themselves and their potential for change. So that's rewarding, I think, for all of us.
I think also going off of what Theo was saying as well, I think motivation, it's kind of a cycle, and it revolves, it involves and revolves around both parties. So the more that we're enthusiastic to go in there and do programming, it motivates them, and their motivation motivates us. It's definitely a lot of give and take, and usually it starts with us being really excited that they're there, and they're pretty skeptical, but the more that they see us go in there every day and just be excited to be there and do the programming with them, because we've seen success in the past, we can see the success before it happens. It's not always a guarantee, but I think that because we go in there with such a positive attitude, a lot of our clients have reflected that back to us, where they're excited just to see us excited about something. And for us to do something we're passionate about really does, I think, influence them finding passion for themselves and their own recovery, and hopefully something else that they'll be passionate about in their life that does not revolve around substances, which has been their full life probably up.
That's awesome.
What better way than to model, I think, because if we go in happy, then it's like they're seeing somebody who's happy, and maybe they've never been happy in their lives, right?
Yeah.
So to see that and to channel it, it's a little different. I also think success is a spectrum. It really is. Because even there's a success of one person not using a substance for one day or making it through that one day. It's not even the 30 days. That's huge for some of these people. A success could be just honoring or recognizing that they have been using substances since the age of 5, right? That's huge.
Mm-hmm.
And awareness that they've been in jail more than they've been in the outside world. That's a success, just realizing those things.
Yeah.
I even think sometimes when they're shouting at us or at me and they're like, I don't like you today. I'm like, great. I'm glad that you felt safe enough to express that to me, and that it's okay. You're going to be okay. I'm not going to hurt you. You're not going to be hurt. It's going to be fine. Right? That's also a success. So when you ask about success stories, or maybe our favorite story, they're all encompassed in a way. But they're the little things, it's the small steps, or it's the, hey, I got up early today. Yes. Awesome. That's great.
Yeah.
All successes.
Yeah. That's amazing. That's great to hear. Speaking of, like you said, you come in happy, and that kind of, they kind of model that behavior. I was thinking right before you said that, how difficult it may be for your jobs to have to deal with that every day. Somebody yelling at you. I didn't think about somebody yelling at you. I was thinking of them going through withdrawals, and how I've seen somebody go through withdrawals, and it's difficult to watch. And dealing with that on a day-to-day basis, maybe it's not day-to-day, but probably very often. Does that affect you personally? And do you have to like work on yourselves every day and like motivate yourselves? I can imagine that. I can imagine being very difficult.
Yes. Yeah. Uh-huh.
Okay.
Mark did a really great synopsis of what the Matrix is, and when you had asked what the groups are like, I wanted to say it's like screaming goats. That's what a session looks like sometimes. It's a little chaotic.
Yeah.
But I think that's why this program is so effective also, is because we understand that.
Yeah.
They come in like that, and we know it, and we're ready to catch them,
Mm-hmm.
But yes, is it work in progress every day? Yes, for myself anyways. I know I have to like balance out, and it's a lot of heavy metal or something. Like I got to get out my anger too, so that's my thing. I don't know about you. Way difficult.
I think that all of us, any therapist has to do a good job of taking care of themselves to avoid burnout. But I think that, the more you don't take things personally, the more you experience when you work in a setting like this, the more you learn not to take things personally and that it's just really not about you. And I feel like we all do a pretty good job of being able to do that and understand that this is somebody else's journey. And we've seen this a lot. And at least I don't take it personally. It doesn't always feel good, but it definitely, we know that it's not really about us and that we're still doing a good job. But really, for the most part, like in my experience, I receive a lot more positive feedback for the presence that I have for them in their journey and their experience in being incarcerated, rather than the backlash. And if I've had a lot of people apologize too for blowing up and then being like, you didn't deserve that and I was having a bad day. And then there's a lot of rupture and repair there, which is also really therapeutic and healing and really important. And like Al said, for them to feel comfortable enough to explode on you, like actually really is a lot of progress. And although sometimes we feel like a punching bag in there, it's not that. So just reminding ourselves that that's the case, but it's not that damaging in my experience, which is good.
Yeah, definitely. I agree with a lot of what they both said. And I think just showing up and being present, like it means like being there emotionally, like suspending your own stuff. And I think corrections is like supportive of that. For me as a therapist, I worked in several different fields, but there's like physical reminders as you go towards your unit because there's so many levels of security and like thick concrete walls and barbed wire. So it's like really like your world, and your life is out here and you go in there. So for me, it helps me to be like present and focused being in the facility. And then, remembering we're lucky because we do get to step out of the facility whenever we need to. They don't. But we do get like a lunch break. There's exercise facilities available to us here, which is really, I think, one of the assets of working for the county. So we all do self-care and make sure that we're doing well. But being there for them, we have to show up and remember it's about them and we're there for them. And they appreciate that. We have very appreciative client and corrections, which is something that's really rewarding, I think, for all of us that work there.
And, I think it's important that you're all emphasizing that recovery has, it's a journey, right? And there's different milestones in that journey. What would you tell the public in regards? I feel like there's a lot of stereotype around right now, the opioid crisis and what's going on with fentanyl. And I think more than we'd like to admit, we have our own families who are struggling with addiction and abuse. What would you tell them from a therapist perspective about, some incorrect, thoughts about a substance disorder? And how would you educate the public about, hey, people have disorders around substance issues. And what would you all say about that?
For one, addiction and incarceration does not discriminate. It is not just the homeless population or people who are chronically mentally ill and have co-occurring things. We do see that a lot, but it is not the only piece that we see that it could happen to any of us. We're all one short step away from incarceration, and people think that they're so far removed from that, but they're really not. That these are people from our community, whether we see them incarcerated or we see them at the grocery store. And they deserve to be treated like a member of our population. And they don't often feel like they're treated well while they're incarcerated just because of the nature of incarceration. But to remember that they are just members of our community just like anybody else is.
Yeah, I was just thinking also that what to say to the public. Some people aren't ready to take these steps, Yeah. Just because they're in and out of this system doesn't mean they're ready to be clean or sober. And it may be, like you said, a milestone. It is a very big step to even admit to have a problem. So I would also want to say that some people aren't ready and you can't force it on them. That's what I think makes the Matrix so great, is because it is a voluntary program. When they decide, hey, maybe I need help, that's a step. Even if they're not ready and they're thinking about it, we're still planting a seed and they're still considering it. But some people aren't ready. And I think, there's so much of like, help. But maybe they don't want help. Maybe they're fine doing what they want to do. Yeah, but the Matrix, we've had how many? 116 graduates. Oh, that's grown. I think like 18 groups. 116. Yeah. So with this program, we've reduced recidivism by 66%. What? Well, yeah,
That's incredible.
yeah, I think so.
Yeah, absolutely. What I love that we're doing this podcast because I've worked for the county for 13 years, and I just recently found out that the jail has nurses, has psychiatrists, has doctors, dentists. I had no idea about that. I'm sure the public doesn't know about that. And now therapists did not know about that until recently. So given that the public is probably on the same page as me, what's something that you would want the public to know about the therapists in the Santa Fe County Correctional Facility?
About the therapy.
About you guys,
Sure.
yes. Your team,
What else do we provide there?
whatever you want to share. Everything.
That were awesome. I would say, I don't know. I just want to elaborate that what you said. We do have a lot of providers, and they all work very hard. We have a reentry specialist. We have, our psych nurse practitioner who's fantastic. It is a really, really big team.
I think that something that is really important is, I think when a population who has never experienced being incarcerated, never worked in an incarceration facility, we kind of loop all incarceration facilities together and assume that nothing gets done there, and it's just a punitive system. But especially at our facility, and I can always speak to that because it's the only place I work and the only place that I've ever been incarcerated, if you will. But we do have a lot of different disciplines that are looking to care for our population in there. Like you said, we have dentists, we have a big medical team, we have a doctor, we have nurses, we have the psych nurse practitioner, they have us. They have all these systems that not a lot of jails or even prisons have, and that we do genuinely care regardless of the discipline for these people in our community, and they do get seen. If you want to see a therapist out there, you are oftentimes waiting on a wait list for quite a while. You can't just pick up the phone and call your therapist. In there, we respond to people either using our Keep system, which is like an electronic system. They have one in the pod, and then we can check it on our computers. They can send a message at any time. They can ask security staff, hey, I need to talk to the therapist right now. We're there within 5 minutes to, at the most, 24 hours, responding to whatever needs they have. So when they need something, they do receive services quickly, and people are responsive to that, whether it's medical, dentist, or behavioral health, that we're on it. And they don't oftentimes get that sort of availability to resources in the community.
I really appreciate you saying that, because I think that there's a lot of stereotype in community and across the United States about our adult detention facilities,
Right.
and what it means. And also families, right, being scared. I mean, many times these are your children
Right.
who've committed crimes or who are really struggling with their lives and have behavioral health problems, who are not getting the services anywhere else.
Right.
And so I just think the compassion that you all bring to the work, and an understanding that you have a comprehensive team to try to tackle these issues. And of course, it's not easy, but I think that's just a powerful message to get out to our staff and to the community that, hey, our staff care, and we're here to serve. And wherever you're at in your journey with recovery, you guys are here to do that work.
And I think that something else that's really important is people who are newly incarcerated, they do have a lot of that fear of like, oh my gosh, I'm in jail. What's going to happen? This is a scary place. People who have been repetitively reincarcerated, they know that they're going to get services there. And so for some people, it's like, okay, I'm feeling a little bit more relaxed because I know that I'm going to get the medical attention that I need, or I'm going to get the behavioral health services, get back on my meds, whatever it is. So the people who are accustomed to that system obviously understand it a little bit better. And I think that's important for the community to know that they know they're going to get services there if they've been there before. And hopefully help stabilize them so they don't come back. But if they do, they know that they're going to get treated.
So let's talk about the reentry program and kind of wrap a little bit.
I know we kind of started having our reentry pod after last fall, that graduating class, because Matrix it's an isolated pod from the rest of the population. It's a sober pod, and so our graduates were expressing like, what do we do next? They didn't want to necessarily go back with like general population because they had maintained that sobriety for that period of time and they wanted to keep it going. And then our team and the warden was able to like create this reentry pod where we continue doing programming and groups with them. There's like some really good groups. Al does a really cool group. Alyssa does a really cool group. We all kind of bring our experience and our background and our skills to these groups. I'm going to start doing nonviolent communication this month with those guys that graduated Matrix last month. And I've done anger management and trauma groups in there. So keeping them stable, they start building work skills in there and then making plans for like their employment and housing when they leave the facility. And yeah, they change quite a bit while they're Matrix, and then that kind of helps them to sustain some of those changes that they made in their choices and behaviors. And I'll pass it to one of you ladies.
I'll just quickly say, because I'm so excited about the group that I do, I'm so passionate about it, but I do an ecotherapy group, which sounds kind of strange considering we can't go outside, but it's all about like nature therapy. And so preparing them for when they do get out, that they're able to like have the resources and the tools and the skills and the knowledge to go out into the wilderness and participate in things that maybe they did when they were a kid or that they've never done before. So talking about those sorts of things is really, really fun. And I love doing that. I mean, I love the Matrix too, but I really like doing that because I'm passionate about it. And so getting them passionate about nature for when they do get released, because for most of them, sometimes they go to prison, sometimes for a long time, but for most of them, they are going back to the community in a relatively, short amount of time. And so getting them prepared for that with tools and things to get excited about, I think is really fun. And they really enjoyed that.
Yeah. I am obviously the art therapist, but I really focus on an art group and different coping skills or techniques that they can also use going forward. A lot of them, they realize, oh, I'm kind of really good at this. And then they go out and they're like, I'm going to go buy me a chalk set. I'm like, that's awesome. That is something that you can do. Other things that we have in the program, we have a PTSD group. We have, we're going to have a creative writing class coming soon. We're doing a lot of life skills, which is resume building, interview, role playing, which is personally my favorite. Circle of Security Parenting is another class that we offer. We give them a job. They get to actually work. They'll work in the kitchen, so they can get money and earn that money for commissary if they want, or to buy other supplies for themselves. So it very much is regimented, similar to the Matrix, in that you get up in the morning, you have programming, you go about your day, and then you end at a certain time with programming, kind of like an 8 to 5, right? So you get up, you do your thing.
So you have a rhythm, right? You have a process for your life. Yeah.
I'm really working hard on this relapse prevention plan group, which is, what do you do, right? What is the next step when you get released and you walk out these doors? What is the plan? Because that's the scariest part. And we can even see it on people's faces. They got 2 weeks to go. They're about to be released and they're like, I'm scared. And that's hopefully what that group's going to help, is with that next step, right? Of here's what you're going to do and here's your plan, and it's going to be okay.
Wow. That's scary, thinking about being in jail and being let out into the world. I can't imagine that feeling. But all right, I think, do you have any more questions?
No, I just want to thank you all for your time and for your service to our community, and for, talking about the work you're doing. And
all right. Yeah. Thank you very much. I really appreciate it. And thank you for listening. Listen to us on your favorite podcast, Apple Podcasts, Spotify, and what's the other one? iHeartRadio. And follow us on social media on Santa Fe County.
This is Beyond County Line.
Yep.
Thank you for joining.
Thanks.